Crystalluria in cats. The hidden threat. Many owners don't know about. What if I told you that a single word on your cat's lab report could mean nothing, or be a sign of serious trouble? When you see the term crystalluria on a vet report, it's natural for your heart to skip a beat. But what does it actually mean? Crystalluria isn't a diagnosis in itself. It's more of a signal, a lab observation confirming the presence of microscopic mineral crystals in the urine. This can be a completely harmless finding, or it could be a marker for serious health issues. Not all crystals are created equal. Did you know that the type of crystal is crucial? In most cases, the crystals found in a cat's urine are either struvites, made of magnesium, ammonium, and phosphate, or calcium oxalates. Their formation is directly linked to the concentration and pH balance of the urine. However, there are other, much rarer types of crystals that are almost always a red flag for a serious underlying condition. Ammonium biurate crystals can point to a portosystemic shunt, a congenital liver vessel abnormality. Cysteine crystals indicate cystinuria, a hereditary defect in amino acid metabolism. That's why identifying the type of crystal is the foundation for all further diagnosis and treatment. The causes, from lab error to poisoning. To tell a real threat from a false alarm, it's vital to understand where these crystals come from. Sample handling artifacts. Imagine this. The problem might not be with your cat at all, but in the test tube. The most common cause of a false positive is simply how the sample was handled. Crystals, especially struvites, can form in vitro, meaning in the test tube, if the urine isn't analyzed quickly or if it's been stored in the cold. To avoid this, the sample needs to be analyzed as soon as possible, ideally within 30 to 60 minutes. If that's not possible, it can be refrigerated for up to 12 hours, but it's crucial to warm it back up to room temperature before analysis. 2. Clinically significant factors. But what if the problem is inside your cat? The formation of crystals within your cat's body points to specific risks. Overly concentrated urine because the cat isn't drinking enough water, an imbalance in the urine's pH level. Struvites love an alkaline environment, while oxalates form in acidic urine. Persistently alkaline urine can also be a sign of a urinary tract infection caused by specific types of bacteria. An unbalanced diet with an excess of certain minerals. Poisoning. The most frightening scenario is ethylene glycol poisoning from antifreeze. This tragic situation leads to acute kidney failure, with calcium oxalate crystals appearing in the urine within just a few hours. This condition requires immediate emergency veterinary care. When delay is deadly, the signs of a blockage. The microcrystals themselves don't cause pain. The real nightmare begins when they clump together to form larger particles, sand or stones, uroliths, which can cause inflammation or, worst of all, a complete blockage of the urethra. Memorize these signs. This is a race to the emergency vet. If your cat is straining in the litter box with little or no urine coming out, making frequent trips to the box, crying out in pain, becoming lethargic and refusing to eat, get your cat to a vet immediately. A complete urethral obstruction is a situation where every hour counts. Without emergency help, a cat can die from acute kidney failure and systemic toxicity within 2 to 3 days. Accurate diagnosis is key to proper treatment. So how do vets get to the bottom of it? The diagnostic process starts with a urinalysis. To check for infection, a bacterial culture is needed, but this requires a sterile sample obtained through a procedure called cystocentesis, a quick needle poke into the bladder through the abdomen. Urine collected from a litter box is fine for a general analysis, but it's completely useless for a culture due to the high risk of contamination. To find stones, vets use imaging. Ultrasound and X-rays are two allies that see what the naked eye can't. They complement each other perfectly because some stones, like urates and some cysteine stones, are radiolucent, meaning they're invisible on a standard X-ray. In these cases, an ultrasound or a contrast X-ray becomes the main diagnostic tool. Treatment strategies. Dissolving and preventing. The treatment strategy depends entirely on the enemy we're facing, struvites. Fortunately, in cats, struvite stones are often sterile and can be dissolved. The vet will prescribe a special therapeutic diet that makes the urine more acidic and lowers the concentration of magnesium and phosphorus. Calcium. Oxalates. These stones are trickier. Diet can't dissolve existing ones. If they're causing problems, they need to be surgically removed. The main goal is lifelong prevention through a diet that keeps the urine pH in a neutral range, around 6.6, 7.5. And, of course, by maximizing water intake. But there is one universal key to urinary health, no matter the crystal type, and that key is water. Wet food is your best friend in this mission. Water fountains are also great for encouraging cats to drink more. As a little trick, you can add a bit of broth to their water, but make sure it's made without salt, onions, or garlic, as these are toxic to cats. In the end, finding crystals in your cat's urine isn't a sentence, but a starting point for a thoughtful conversation with your veterinarian. Understanding the crystal type, assessing all the risks, and getting an accurate diagnosis makes it possible to create a targeted plan that will help maintain your beloved pet's health and quality of life for years to come.